Good day, sir. I am Dana Delicano, your student nurse for today, and I'm going to demonstrate the mouth and oropharynx. So the first procedure that we're going to do is we're going to explain to the patient the procedure and we're going to provide privacy. So good day, sir. I am Dana Delicano, your student nurse for today, and I'm going to assess your mouth and oropharynx. So I'm going to check if there are any problems or abnormalities. And then I'm gonna provide privacy to the client. I'm gonna close the door and curtains. And I already wash my hands and I already wear gloves. So the first that we're going to inspect is the lips and buccal mucosa. So first is we're going to inspect the outer lips for symmetry of contour, color, and texture. So for the symmetry and contour, atong i-check if ang patient unsay porma sa iyahang lips. And for the color, we're going to check if it is pink, red, or pale, or kanang black. So, black is mo na siya katong mga gasigarilyo. And for the texture, we're going to check the moisture or the softness sa kanang lips niya because that is the normal kuan. And next is we're going to ask the client to purse the lip as if nga mo siya ga-whistle. And next is we're going to inspect the inner lips and buccal mucosa for the color, moisture, texture, and or if there are any presence of lesion. So I'm going to use my pen light and tongue depressor. So, sir, pwede i-purse ni may mong lips? Okay. So, pwede ba i-open ni may mong mouth, sir? So, we're going to check the buccal mucosa where we can find in the part. Okay, so next is teeth and gums. So we're going to inspect the teeth and gums while examining the inner lips and buccal mucosa. So sir, can you please open your mouth? Okay, thank you, sir. So, for kanang mga patient sad nga nag-use sa ilahang denture, sir, or marpil, we let them kanang ipahubo sa ilaha for us to check the condition of their kanang dentures or we can note kanang particular broken or worn areas. So, next is tongue or floor of the mouth. So, we're going to inspect the surface of the tongue for position, color, and texture. So, we're going to ask the client to protrude his tongue by using my pen light. Okay. So, sir, can you please protrude your tongue rather? Okay. So, next is we're going to inspect the tongue movement. So, we're going to ask the client to roll his tongue upward and move to side to side. So, sir, can you please roll your tongue upward and upward? Side by side, sir. Okay, slowly lang, sir. Side na sad, sir. Okay. So, we're going to inspect the base of the tongue, the mouth floor, and the frenulum. So, we're going to ask the client to place the tip of his tongue against the roof of the mouth. So, sir, can you please put the tip of your tongue against the roof of your mouth? Okay, thank you, sir. So, next is we're going to palpate the tongue and the floor of the mouth for any nodules, lumps, and excoriated areas. And I'm going to use a gauze pad to grasp the tip of the tongue, and by using my index finger, I'm going to palpate the back of the tongue, its border, and its base. So, sir, can you please open your mouth and show your tongue? Okay. So, wait na. So first is we're going to palpate the back of the tongue and its borders and sa iyahang base. Dire. Okay. So next is salivary glands. So we're going to inspect the salivary duct openings for any swelling or redness. Sir, pwede nga ka, sir. So next is palate and uvula. So I'm going to inspect the hard and soft palate for color, shape, texture, and the presence of bony prominences. So I'm going to ask the client to open his mouth wide and tilt his head backward. And I'm going to use my tongue depressor and my pen light. So sir, can you please open your mouth wide? And then I'm going to tilt his head. And then I'm going to use my tongue depressor. Okay, thank you, sir. So next is we're going to inspect the uvula for position and mobility while examining the palate. So to observe the uvula, we're going to ask the client to say so that the kanang soft palate rises. Okay, by using my pen light again. So sir, can you please say Next is oropharynx and tonsils. So I'm going to inspect the oropharynx for color and texture. So I'm just gonna inspect one side at a time to avoid eliciting the gag reflex. And to expose the oropharynx, I'm going to press a tongue blade against the tongue at the same time about halfway. And I'm going to let the client's head tilt backward and let his mouth wide open. Okay, so one side at a time lang atong pag-check, and I'm going to use my pen light. And okay. So next is we're going to inspect the tonsils. So we're going to check the color, discharge, and size, and elicit the gag reflex by pressing the posterior tongue with a tongue depressor. Sir, can you please open your mouth? So that's it, sir. So I'm just going to document the assessment. So wait lang, sir. So sir, upon checking your assessment, there's no any presence of abnormalities or problem on your mouth and oropharynx. So that's it, sir. Thank you for your cooperation.